everyone. Welcome to Senate Health and Human Services for Tuesday, May 11th. I'm going to go ahead and call this meeting to order with a roll call. Oh, my apologies, Norma. I jumped. I may have surprised you there a little bit. So go ahead and do roll.
Senator Hardy. Senator Harris. Senator Keffer. Senator Spearman.
Here.
Chair Ratty.
Here. All right. We had a busy day here today in Senate Health and Human Services. We're going to do a work session, and then we've got two bills to hear. But we're going to start with our work session while we have all of our members. So, Ms. Kamlasi, I'm just going to ask you to jump right in.
Thank you, Madam Chair. Megan Kamlasi with the Research Division of the Legislative Council Bureau for the record. The first bill on work session today is AB 96. This bill was heard in committee on May 4th. It authorizes a governmental entity that licenses and regulates emergency response employees to contract with a nonprofit organization to establish a program to provide peer support counseling for these employees who are experiencing mental health issues as a result of the nature of their work. The bill also requires DPVH to post on its internet website information concerning peer support services available to emergency response employees. The division must also, to the extent funds are available, collect and report certain information relating to suicide among emergency response employees to the chief medical officer, and no amendments were proposed for this measure.
All right, committee, do we have any questions or clarifying comments on AB 96? Seeing none, looking for a motion. I've got a do pass from Senator Spearman. Second from Senator Harris. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Senator Hardy, would you take this one on emergency response employees? Sure. Great, thank you. All right, we're going to move on to the next one. Thank you, Ms. Kamlasi.
Thank you, Madam Chair. Megan Kamlasi for the record. Assembly Bill 119 was heard in committee on April 22nd. It revises the duties of the Maternal Mortality Review Committee to include identifying and reviewing disparities in the incidence of maternal mortality in this state by analyzing the race, ethnicity, age, and geographic region of the residents of mothers who experience maternal mortality. The bill also requires the committee to collaborate with the Advisory Committee on Minority Health and Equity within the Office of Minority Health and Equity of the Department of Health and Human Services in developing its biennial report, and no amendments were proposed for this measure.
Anybody have any clarifying questions on this one? Seeing none, looking for a motion. Do pass from Senator Spearman. Second from Senator Harris. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Senator Spearman, would you like that one? Okay.
Thank you, Madam Chair. Megan Kamlasi for the record. Assembly Bill 177 is up next. It was heard on April 29th. This bill requires a pharmacy, except an institutional pharmacy, to provide the information required to be included on the label of a prescription drug in English and, upon the request of a prescribing prescriber, patient, or authorized representative of a patient, any language prescribed by the State Board of Pharmacy. A pharmacy must post in a conspicuous place a notice informing patients that they may request this information in a language other than English and a list of the languages in which the information is available. Assemblywoman Benitez Thompson proposed the attached conceptual amendment during the bill hearing.
Any clarifying questions on this one? All right, I'm not seeing any. It would be an amend do pass, looking for a motion. Amend do pass from Senator Harris. Second from Senator Spearman. Any discussion on this one? Not seeing any. All those in favor signify by saying aye. Aye. Any opposed? Nay. Got one nay from Senator Hardy. Otherwise, motion passes 4-1. And he's reserving his right. All right. Anybody in particular want this one? All right, I'll take it. Okay, we'll move on to Assembly Bill 181.
Megan Komlossi for the record. Assembly Bill 181 was heard in committee on April 29th. It requires certain health insurers that provide health coverage for their employees to comply with the federal Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act of 2008, which prohibits group health plans and health insurance issuers that provide benefits for mental health or substance use disorders from imposing less favorable benefit limitations on those benefits than on medical and surgical benefits. The bill also requires each insurer or other organization subject to those requirements to submit to the Commissioner of Insurance certain information that demonstrates compliance with the Act. The Commissioner may adopt regulations to carry out the provisions of the bill, shall keep certain information confidential, and must submit annually a report to the various entities. The bill also requires certain providers of health care to provide information relating to suicide to the Chief Medical Officer pursuant to regulations adopted by the State Board of Health. Specifically, it provides for the confidentiality of personal information concerning a suicide or an attempted suicide reported to the Chief Medical Officer. It subjects a provider of healthcare who willfully fails to make such a report to a misdemeanor, penalty, and administrative fine, and requires the Chief Medical Officer to annually submit a report summarizing any information relating to suicide to the Patient Protection Commission. And Assemblywoman Peters proposed the two amendments, conceptual amendments listed on your bill page during the bill hearing.
All right, folks, we have a couple of amendments on this one. Any clarifying questions? Senator Hardy?
Thank you, Madam Chair. I had concerns when it started talking about any healthcare provider when it gets into a situation where it may be discoverable, even though it, quote, is confidential. So my question would be, how do we protect the person's identity when it comes from a individual practice, for instance, as opposed to a hospital or some other conglomeration of practices?
Okay, Assemblywoman Peters, did you hear the question? And it looks like we have Dr. Woodard available as well, but we'll start with Assemblywoman Peters. It's about the confidentiality in the smaller practices.
Thank you, Chair, and thank you, Senator, for the question. I actually request that we pass that question on to Dr. Woodard, who is better versed on how their office would.
There's a little bit of breakup there, so for the record, I believe that Assemblywoman Peters said that she appreciated the question and would like to pass it on to Dr. Woodard, who may be more versed in the specifics of this. Assemblywoman Peters, if you would just nod, if that's generally what you were saying. All right, so we've got that for the record. So Dr. Woodard.
Sure. So Stephanie Woodard for the record. I believe Kyra Morgan may also be on. So if I don't address all of the issues related to the confidentiality of data, I may need her to also participate in the answer. But again, just to clarify the intent of the legislation, in regulations, we will stipulate the providers that we would be expecting to make these reports. And we are looking for these reports primarily to come from providers within hospital settings, not independent practices. That being said, this legislation would fall under NRS 441A, where communicable diseases and very highly sensitive information, which needs the ultimate in confidentiality and data protection, are typically transmitted to the Division of Public and Behavioral Health and held by the Office of Analytics. So I do see that Kyra Morgan is here. Chair, if it would be okay with you, I would like to offer the opportunity for Kyra to also provide a little bit more information around the data security that the Office of Analytics uses related to confidentiality.
That would be great. Ms. Morgan?
Hi, this is Kyra Morgan for the record with the Department of Health and Human Services. Dr. Woodard is correct. So our plan would be to actually utilize existing data collection mechanisms that we have in place under 441A for overdose reporting and just extend that to include these data on suicide and suicide attempts. So the mechanism for confidentiality is completely in place, and then we would hold the data as confidential and obviously would not release anything in any kind of public setting that would allow for re-identification of an individual.
Senator Hardy, did that answer your question?
Almost. So all I need is, does this only apply to hospitals, or is there a provider of healthcare other than a hospital that has to do this? So, for instance, a group practice, a individual person, are any of those captured in this, or is it just hospitals?
At this time, the intent is just hospitals, and so the regulations that would be developed subsequent to this legislation would define that, I think, for greater clarity for you.
I have disquiet when they say the intent is.
So I think where we're landing, just to be clear for everybody on the record, is it's not explicitly in the bill, but the intent is to only do a regulatory process that would lead towards hospitals. But I think that I understand your concerns, Dr. Hardy, so I'll leave it up to you where you want to
I'll be
land, of course.
voting no with the right to change.
Got it. Okay. So any other clarifying questions? Great. Please, thank you, because if Mr. Robbins is chiming in, that usually means that I've said something that's inaccurate. So we'll turn it over to Mr. Robbins, please.
Yeah, well, it's not that something was inaccurate so much as just that a clarification for our drafting purposes. So currently the bill just says a provider of healthcare who knows of or provides services to a person who is a person who, I guess with the amendment, has attempted suicide would be required to report in the manner prescribed by the regulations of the board, but the bill doesn't expressly provide for the board to adopt regulations that designate the providers, which seems to be what Dr. Woodard was saying would happen. So I am just wondering if that should be explicitly added to the amendment.
So Assemblywoman Peters, your bill, I see Dr. Woodard nodding, but would you like that to be explicitly added to the amendment, that is the intent, that the regulatory process would identify the providers?
Dr. Woodard, does that work for your office and the regulatory intent? Then yes, I would appreciate that. And I'm sorry, I apologize. Sarah Peters, for the record, I did think that in our amendment, there was a piece that clarified both facilities and providers, which would then have to be defined in the regulatory process. So I'm sorry if that didn't make it into the proposed amendment.
We do not have to rush. So there's two proposed amendments. If you would like to try to point us to a specific section of an amendment, or Ms. Kamlasi, if you can provide any assistance there.
Megan Kamlasi for the record. I think at this point, based on what's in the bill page of the work session document, you see items 1 and 2. Item 2 requires either a provider of healthcare or the medical facility in which a healthcare provider works to report required information related to attempted suicide. And it doesn't actually relate to the regulatory piece. So I think if the intent is to have the State Board of Health adopt regulations identifying which types of healthcare providers or provider facilities must report this information, then we'll just add that as an additional amendment on the record, and we can make that happen in the next reprint.
I think that works for everyone. Again, Sarah Peters, for the record, thank you, Chair, for the discussion on that and for getting to the intent.
I appreciate it. It's a little unusual for us to work through it in a work session, but if it makes the bill better, I'm all for it. And so it looks like we're in good shape. Dr. Woodard, Ms. Morgan, you believe you can implement it based on this conversation? Okay. And Mr. Robbins, you believe you have the intent for drafting? And
Yes, we are good.
And committee members, you believe you understand what it is we're voting on? Okay. So with that, I would take an emotion. An emotion. I'm full of emotion. I would take a motion. It's amend, do pass.
I'll move to amend and do pass.
All right, I got an amend, do pass from Harris, second from Spearman. Any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? All right, so we've got Senator Hardy as a nay, holding his right to reserve, and so it's 4-1, bill passes. And with that one, Senator Harris, do you want to take that one? Great. Okay. Let's move on to AB 217.
Thank you, Madam Chair. Megan Komlossi for the record. AB 217 was heard in committee on May 4th. It requires the administrator or other person in charge of designated medical facilities, facilities for the dependent, and other licensed facilities to ensure that each unlicensed caregiver at the facility completes certain training, including training on the topic of the control of infectious diseases. The measure requires the State Board of Health to adopt regulations prescribing training for unlicensed caregivers who provide care at such facilities. The administrator or other person in charge of such a facility shall ensure the implementation of best practices taught in the required training and shall develop, annually update, and provide to certain persons a written plan for the control of infectious diseases at the facility. Finally, this bill requires the Division of Public and Behavioral Health to post on the internet a list of nationally recognized organizations that offer free or low-cost training that meets the requirements of those regulations, and no amendments were proposed for this measure.
All right, any clarifying questions on this one? Seeing none, got a do pass from Senator Spearman. Second from Senator Hardy. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Senator Kiekefer, would you take that floor statement? Thank you so much. All right, moving on to AB 399. I will say that the senator who makes the most puns using the word eggs in this discussion will get the floor statement. So
That sounds like an excellent plan.
there's one for Harris. Ms. Komlossi?
Thank you, Madam Chair. Megan Komlossi for the record. This bill was heard on April 27th. AB 399 prohibits an egg or egg product from being sold, offered for sale, or transported for the purpose of sale in Nevada if it's produced by an egg-laying hen that is confined in certain enclosures. The measure prohibits farm owners and operators from knowingly confining an egg-laying hen in an enclosure that does not comply with the bill's provisions, with certain exceptions, and requires such owners or operators to obtain a renewable endorsement from the State Department of Agriculture indicating compliance before selling or transporting for sale eggs or egg products in the state. The department may use a government inspector or a private inspection or process verification provider to ensure such compliance. The bill also declares that the legislature finds the regulation of egg production on farms and the sale of eggs and egg products in the state is necessary to protect the health and welfare of its citizens, promote food safety, and advance animal welfare. And the attached amendment was proposed by Jeff Dixon, Nevada State Director, Humane Society of the United States, during the bill hearing.
All right, any clarifying questions on this one? Everybody has the amendment in the work session. Senator Kiekefer.
Thank you, Madam Chair. I unfortunately missed the hearing on this bill, but my understanding is that, so is the amendment that is before us the same as the one that was proposed during the committee hearing?
Yes.
Okay. Thank you.
Did you have a comment, Senator Spearman?
I just think it's an excellent example.
An excellent example. We've got a tie. All right. Seeing no further discussion, looking for a motion.
I've
got an amend do pass from Senator Spearman. Second from Senator Harris. Comments? Last chance.
Big egg.
I'd like to get it on the record. Was there an example of one of these cages?
I think we've seen some. All right. Under the wire, Harris takes the lead. All those in favor signify by saying aye. Aye. Any opposed? Motion passes unanimously. Senator Harris earns the floor statement. Congratulations to all the assembly members who have had their bills make it out of committee on this wonderful day. And now we'll move to the Senate. Senate Bill 420.
Megan Komlossi for the record. Senate Bill 420 was heard in this committee on May 4th. It requires the Director of the Department of Health and Human Services, in consultation with the Executive Director of the Silver State Health Insurance Exchange and the Commissioner of Insurance of the Department of Business and Industry, to design, establish, and operate a public health benefit plan known as the public option. The public option must be available to all natural persons who reside in Nevada, both through the exchange and for direct purchase. It may also be made available to small employers or their employees. The public option must meet requirements established by federal and state law for individual health insurance or health insurance for small employers, and must meet certain coverage and premium requirements. The Director of DHHS, Executive Director of the Exchange, and the Commissioner of Insurance must apply for certain waivers to obtain federal financial support of the public option. The Director of DHHS must also use a statewide competitive bidding process to solicit and enter into contracts with health carriers and other qualified entities to administer the public option, though the Director may administer it if necessary. Health carriers that provide health care services to Medicaid recipients through managed care must participate in the competitive bidding process. Healthcare providers and facilities who participate in Medicaid, the Public Employees Benefits Program, or the state's Workers' Compensation Program must enroll as participating providers in the public option. Further, the bill establishes the Public Option Trust Fund to hold certain funds for the purpose of implementing it. In addition, SB 420 makes various changes to expand Medicaid coverage. Specifically, it requires the Director of DHHS to expand coverage under the state plan for Medicaid for pregnant women in 3 ways. It requires Medicaid to cover the service of certain community health workers and doulas, as well as breastfeeding supplies, certain prenatal screening and tests, and lactation consultation and support. It requires fee-for-service Medicaid to reimburse services provided by an advanced practice registered nurse to the same extent as if provided by a physician. And it requires the department to establish Medicaid managed care programs in all geographic areas of the state. And the attached mock-up was proposed by Senator Canizaro following the bill hearing.
I think where we are today is that I would like to give Senator Canizaro the opportunity to highlight what's in the amendment, the mock-up, if senators are okay with that. Is that helpful? Looks like it is. Go for it.
Thank you, Chair Ratty. Nicole Canizaro, Senate District 6, for the record. What you have before you in the mock-up that has been provided to the committee is a mocked-up version of the conceptual amendment that the committee did have before it at the time of the hearing, and includes the different changes that we had made to clarify not only some of the aspects of the public option with respect to Medicaid or better reimbursements, with respect to who would need to bid on the public option, but also includes the amendment for the allowance for multi-employer plans to apply to get federal acceptance in order to offer some of their plans for employees who might otherwise be without health insurance. So you're seeing that in the mock-up. And then additionally, thanks to a question that was raised by who I believe is Chair Keykever in this committee, with respect to the 15% for the premium reductions, we did add language to clarify that that does apply to the public option. It was not intended to apply to all healthcare plans. It's intended to apply to the public option. So that is included in the mock-up as well.
Okay, thank you, Senator, for walking us through that. Any members of the committee have any clarifying questions on the mock-up? We're just going to give folks a minute. All right, committee, I'm not seeing any questions, so I will look for a motion. Amend do pass from Senator Harris. Second from Senator Spearman, opening for discussion. Senator Kiekefer.
Thank you, Madam Chair. I appreciate it, and I certainly appreciate the mock-up. It seems to be directly in line with what we discussed. I still believe that we have incredible tools at our disposal to try to tackle the uninsured population in Nevada through continued outreach through Medicaid, as well as the eligible but unenrolled population for the exchange, knowing that they have significant increase in subsidy through the American Recovery Plan, and without really understanding how we're going to capture some of the other populations of uninsured, I can't support it at this time based on the disruption that I think will happen in the insurance market. And I'd point out as well that the bill directs the director of DHHS, the director of the exchange, and the director of Medicaid to implement this, and frankly, we haven't heard from them as to either the policy or the applicability of it, and I just feel uncomfortable with it at this time. But I appreciate the majority leader and the committee. Thank you.
Thank you, Senator Kiekefer. Any other comments? I will just say that I think where Senator Kiekefer and I agree is let's all lean in and use the tools that are available to get as many folks covered with we do have people out there on Medicaid who aren't signing up, or who are eligible for Medicaid but aren't signing up for it. We do have folks out there who are eligible for the subsidies on the marketplace who aren't signing up for them. I will take this moment to promote that the marketplace unusually is open at this time of year, and so if you need health insurance, go onto the marketplace and see if you can qualify for a subsidy. That said, I think there have been yeoman's efforts to do that, and we need to do more, but I think that we're still missing a whole subset of Nevadans who need another option, and I think that this is a good option. I'm also hopeful that it'll generate some buzz, if you will, and that buzz will lead people into checking out what they qualify for. And even if they don't sign up for the public option, that they may find out that they are eligible for Medicaid, or they may find out that they're eligible for a subsidy on the marketplace. So because of those reasons, I support this. I think there's a long lead time to get the actuarial information that we need to really push the go-ahead button. And I think that information is going to be invaluable to the state in terms of how we move forward. So I appreciate the majority leader for bringing it forward and will be supporting it. Senator Spearman?
Thank you, Madam Chair. Got two switches up here. Yeah. And I just want to say, and I've heard from folks on both sides of it and understand how some may feel that it's a little bit more complicated than we should get into right now. But based upon what has happened to Nevadans, especially during COVID, and to the BIPOC communities specifically, and the Gwynn Center, if you have not seen it, the Gwynn Center has an excellent report that deals with how communities of color have been impacted by COVID-19. I think because of that, because we do need to make sure that people have insurance options, some may say it's not perfect, but I don't think that we should let perfect be the enemy of good. So.
Okay. Senator Hardy.
Thank you, Madam Chair. I appreciate the comments that we've heard. One of the concerns I have is we're going to talk about the public option, and people are going to be somewhat discouraged when they look at 2025, 2026, when we have a virtual public option now that is not as used as we would like it. So I will be not supporting this measure, as well-intentioned as it may be. Thank you.
Thank you, Senator Hardy. And Senator Harris, let's make it a royal flush.
I'll take that, sure.
Okay.
I just want to say, I think this is a great bill, and it's unfortunate that it's needed. If the private sector was providing health care to everyone at a reasonable cost, this bill would not be a consideration. It is not. And so it is entirely appropriate for the government to step in and try and offer something that folks can afford. We bear the cost when people go uninsured, and it's our responsibility to make sure there's options out there for people and that they're staying healthy. So thank you for bringing the bill. I'll be supporting it today.
Okay, I have a motion to amend, do pass, and a second. With that, all those in favor signify by saying aye. Aye. Any opposed? So I have Spearman, Harris, and Ratty as a yes, Kiekefer and Hardy as a no. Bill passes before the committee deadline. Congratulations, Senator Canizaro. And that, I believe, wraps up our work session. Thank you, Ms. Kamlasi and Mr. Robbins, for all your work on the work session. We'll be losing Senator Harris and Senator Spearman to bill presentations in other committees. It's that time of the session. And so with that, we're going to go ahead and move on to bills that we have to hear today. And we're going to start with AB 438. And I believe we have Ms. Jepson from the Nevada Department of Agriculture. Whoops. SB, that would be SB 438. Ms. Jepson.
Good afternoon. For the record, Ashley Jepson with the Nevada Department of Agriculture. I'm the Plant Industry Administrator for the department. First of all, thank you for the opportunity to present this bill. I do appreciate that. Just for a little bit of context, really the goal here with this bill is for the department to adopt the produce safety rule portions of the Food Safety Modernization Act. This is a federal law that requires farms of a designated size and scope to comply with these codes of federal regulations. They're really aimed at having preventative measures in terms of produce safety outbreaks as opposed to reactionary, as things have been in the past. We've learned a lot from outbreaks that have happened, whether they've stemmed from the farm or where they're at in the distribution system, and it's having farms apply a lot of the things that have been learned. So the goal here is for the department to adopt these produce safety rules so that it can be enforced on a state level versus under FDA, and also to allow the department to react should there be an immediate public safety risk pertaining to an adulterated food, or also an ongoing compliance that is a non-compliance issue pertaining to the Code of Federal Regulations. Just a little bit more context, a lot of these specific federal regulations are aimed at testing water, monitoring for animal intrusion, and health and hygiene practices of staff. Those tend to be the big culprits that contribute to food safety risks, and that's a big part of where these regulations are stemming from. So with that, I will conclude my presentation, and I'm happy to answer any questions or expand upon any of that the committee would like. Thank you.
All right, committee. Everybody completely understand what 21 CFR Part 112 is now? So it sounds to me like we're moving some obligations and duties from the federal level to the local level. Is that based on resources? Is it based on we know our folks better here in the state? Do we have adequate resources to do this?
For the record, Ashley Jepson with the Department of Agriculture. Yes, it is to allow the state to provide the service specific to our producers. We actually did do a survey to gauge whether our producers would prefer to see this on a state level versus having FDA perform the inspections, and it was an overwhelming yes. And yes, there are part of the reason that's justifying this request is in order for us to receive federal resources in order to do this on a state level, we do have to adopt the produce safety rule. We operate under a cooperative agreement, and to proceed with a cooperative agreement, we would have to have this adopted in statute.
Okay, so you need the regs to draw down the resources. All right, any other questions? Can't take a motion because we don't have our members, but it was a good idea, Senator Hardy. All right, seeing no other questions, I'll go ahead and open it up for testimony. Is there anybody in the room that would like to testify in support of SB 438? Seeing none, anybody on the Zoom line that would like to testify in support of SB 438? And BPS, anybody on the phone?
Thank you, Chair Ratty. Callers, if you'd like to testify in support of SB 438, please press *9 now to enter the queue. Once again, to testify in support of Senate Bill 438, please press star 9 now. Chair Ratty, at this time, no callers have indicated that they would like to provide testimony in support.
Anyone who would like to testify in opposition to Senate Bill 438 here? All right, we'll go to the phone lines. BPS, anybody who would like to testify in opposition to SB 438?
Callers, if you'd like to testify in opposition to SB 438, please press star 9 now to enter the queue. Once again, that is star 9 now to enter the queue for testimony in opposition to SB 438. Chair Ratty, at this time, no callers have indicated that they would like to provide testimony in opposition.
All right, anybody in the room who would like to testify in neutral on SB 438? Seeing none, anybody on the Zoom video that needs to testify in neutral on SB 438? All right, looks like we're good. BPS, would you see if there's anybody on the phone line that would like to testify in neutral on SB 438?
Thank you, Chair. Callers, if you'd like to testify for a neutral position on SB 438, please press star 9 now to enter the queue. Once again, to give a neutral testimony for SB 438, please press star 9 now. Chair Ratty, at this time, no callers have indicated that they would like to provide neutral testimony.
All right, with that, we'll close the public testimony on SB 438 and bring it back to Ms. Jepson if there's any closing comments.
For the record, Ashley Jepson, no, thank you, and I appreciate your time.
All right, thank you. We'll go ahead and close the hearing on SB 438, and for your planning oh, actually, it's a Senate bill. We'll go. Ms. Jepson, we're going to go ahead and put it on work session for Thursday if you just want to be able to plan ahead. All right. Okay, we'll close the hearing on SB 438, and that takes us to AB 343, and I'm looking for Assemblywoman Thomas. Has anybody seen Assemblywoman Thomas? Welcome back to Senate HHS, Assemblywoman. We'll let you get settled in. I'm going to go ahead and open the hearing on AB 343, and you start whenever you are ready. Please proceed.
Thank you, Madam Chair and members of the committee. For the record, I am Assemblywoman Claire Thomas, representing Assembly District 17 in beautiful North Las Vegas. This afternoon, I am introducing Assembly Bill 343 and its first reprint, which is a step towards improving the health of Nevadans. It is well established that there is a link between urban planning and the health of a community. When urban areas are designed to include walking paths, bike lanes, and sidewalks, people are more likely to get outside and move, or maybe even commute to work without a car. And being able to walk or bike to stores, restaurants, or work serves the dual purpose of improving our health while reducing greenhouse gas emissions. Clearly, making cities safe and accessible for everyone, including children, older adults, and persons with disabilities, improves the quality of life for all of us. Nationally, the CDC and AARP, along with many land use and transportation planning organizations endorsed the use of walking audits to better understand the needs of a community. The Regional Transportation Commissions in Clark County, Washoe County, along with Nevada Department of Transportation, are already working to improve accessibility for all segments of the population. But it's my hope that this bill will take these efforts to the next level. Assembly Bill 343 was extensively amended in the Assembly based on discussions and input from the RTCs, the health districts, and county representatives. There's also a new amendment from the RTC of Southern Nevada, which is posted on Nellis. David Clyde from the RTC will go over the amendment at the conclusion of my remarks. With that background, let me briefly go over the key provisions of the bill. Subsection 1 and 2 of Section 3 spell out who will be participating in the creation of the plans for walking audits in urbanized areas of our two counties, Clark and Washoe. This bill does not affect the other 15 counties. The entities developing the walking audit plans will be the RTCs, other local governments, and the health districts. In Washoe County, the Truckee Meadow Regional Planning Agency will also be involved, and the Nevada Department of Transportation will participate based on the extent of their jurisdiction in each of the two counties. Finally, after the participants complete the walking audit plans, the two plans will be submitted to the health district in the county and to the interim Legislative Committee on Health no later than June 1st, 2022. This deadline will allow time for the interim committee to decide if further legislative action is needed or appropriate. Subsection 3 of Section 3 provides details on the process to be carried out in developing the plans. The list of planning components in the bill is self-explanatory and designed to provide guidance but not be overly restrictive. The bill allows each of the two counties to develop a plan that meets its own specific needs and that takes into account the differences in the jurisdictions. Finally, subsection 4 of Section 3 defines walking audit and speaks to the components and goals of the audit. Again, the language is not restrictive but lays out desired perimeters and includes things like who should be included in the audit group, the goals of assessing land use and site design, is there lighting, curb cuts, crosswalks, sidewalks, and whether there are benches for people to sit and rest. I also suggested including an assessment of access to healthy food in the walking audits because too many inner city residents have limited grocery and restaurant options. And it is hard to eat well and be healthy when you can only shop at a convenience store or eat at a fast food restaurant. Food deserts are a well-documented problem in many inner city communities, and Las Vegas is no exception. The pandemic has made it painfully clear that a lack of access to healthy food to fight diabetes and other preventable diseases continues to be a national issue. Lastly, the audits would include suggestions on ways to enhance all these factors and thereby improve public health in the audited area. Now, with your permission, Madam Chair, I would like to turn the presentation of the amendments over to Mr. Clyde.
Thank you, Assemblywoman. We'll give Mr. Clyde a minute to get here. Welcome to Senate HHS. Mr. Clyde, please go ahead.
Thank you. For the record, David Clyde from the Regional Transportation Commission of Southern Nevada. Thank you, Chair Ratty, members of the committee. I'd first like to thank Assemblywoman Thomas for bringing this bill forward and being a champion for walkability and advocating for safer and more livable communities here in Nevada. To that end, the RTC is proposing a friendly amendment to AB 343 that we believe will assist in effectuating the bill's objectives related to promoting safer and more livable communities. The RTC's proposed amendment would allow the two RTCs connected to this bill, RTC Southern Nevada and RTC Washoe, to propose one BDR per legislative session. The BDRs would have to be submitted before September 1st, prior to each legislative session. It would have to be pre-filed prior to the start of the legislative session. As the metropolitan planning organizations, we often find as we're engaged in these types of studies and efforts that policies and other objectives tend to come from them. And we tend not to have the authorization in state law to pursue those and to bring about tangible policy changes. We believe through this amendment, we'll be able to better address these tangible policy changes and better implement the efforts associated with this bill. Thank you.
Thank you. All right, any further parts of the presentation, Assemblywoman? Microphone, please.
Assemblywoman Claire Thomas, for the record. I just urge the support of Assembly Bill 343 and the use of walking audits and better understanding our community is a necessity. And I appreciate the time. Thank you.
All right. Committee, any questions for the Assemblywoman or Mr. Clyde? We got to have one. All right, we're going to let you off easy today. It's pretty straightforward. Oh, Senator Hardy.
So thank you, Madam Chair. I'm going to ask you a question. So how did you come up with such a wonderful bill?
I cannot tell a lie. I must tell the truth. The walking audit came from my walking the community last summer when we had the devastating prospect of our children not being able to access the internet. And we had little place cards that we were putting on doors and cars to have parents be able to access the internet. And with that, I noticed sidewalks that were crumbling. I noticed that street lamps that, because it was, sometimes at night that were dim, I was frightened to go down some of the neighborhoods because we didn't know if dogs were going to, come out. It was, and it was suggested by Senator Dina Neal that we should do a walking audit. And that's how this came about.
I like it.
Thank you.
Good question, Senator. All right. With that, we'll go ahead and move to public testimony. Is there anybody in the room who would like to testify in support of SB 438? Seeing none. Anybody on the phone, BPS, opening up testimony in support of SB 438?
Thank you, Chair Ratty. Did you say SB 438?
Oh, I'm sorry. I'm looking at the wrong piece of paper. Let's try AB 343.
Thank you, Chair Ratty. Callers, if you'd like to testify in support of AB 343, please press star 9 now to enter the queue. Will the caller with the last 3 digits of 742 please state and spell your name for the record? You may begin.
My name is Emily Walsh, EMILYWALSH, and I am speaking today on behalf of the Nevada Conservation League. Nevada is ranked the 11th most dangerous state in the nation for pedestrians. We must do a better job to make sure our streets are safe for everyone. This bill will help our state better understand and address walkable neighborhoods and move towards creating safe environments for pedestrians, bicyclists, motorists, and transit riders. Walkable neighborhoods increase physical activity and promote healthier communities, and can help make our communities more safe, accessible, and enjoyable for everyone. Increasing walkability can also encourage people to leave their cars behind, thus reducing greenhouse gas emissions and pollution. We'd like to thank Assemblywoman Thomas for bringing this bill forward, and we urge the committee support. Thank you for your time.
Thank you. Next caller.
For the callers that just joined us, we are on testimony in support of AB 343. If you'd like to provide testimony in support, please press star 9 now to enter the queue. Chair Ratty, at this time, no additional callers would like to provide testimony in support.
Thank you. Anybody in the room who would like to testify in opposition to AB 343? Seeing none, we'll go to the phone line. BPS, anybody who would like to testify in opposition to AB 343?
Thank you, Chair. Callers, if you'd like to testify in opposition to AB 343, please press star 9 now to enter the queue. Once again, to provide testimony in opposition to Assembly Bill 343, please press star 9 now. Chair Reddy, it seems that at this point there are no callers that would like to provide testimony in opposition.
All right, coming back to the hearing room, anybody who would like to testify in neutral to AB 343? BPS, we do have someone, so we'll do in person first.
Thank you, Madam Chair, committee members. Michael Hillerby on behalf of the Regional Transportation Commission of Washoe County. Here hopefully in the correct category, Madam Chair, with the addition of the amendment, officially neutral, because this is not something that's been in front of the board with the changes in the proposed amendment. Much of what's envisioned in the bill are things that the RTC does. Obviously, we invest a lot in multimodal transportation, traffic safety, pedestrian, bicycle safety, making sure that the streets and facilities over which RTC has jurisdiction meet those criteria. And we work regularly with the organizations outlined in the bill, so can do that and appreciate the addition of the amendment. Both RTCs are sizable agencies governed by elected officials in our respective areas, so the idea of having a BDR available certainly makes sense to us. Thank you.
Thank you, Mr. Hillerby. Anybody else in the room who would like to testify in neutral on AB 343? Seeing none, we'll go to the phone lines. Anybody on the phone who'd like to testify in neutral to AB 343?
Thank you, Chair. Callers, if you'd like to testify in a neutral position for Assembly Bill 343, please press star 9 now to enter the queue. Will the caller with the last 3 digits of 490 please press star 6 to unmute yourself? Thank you, caller. Please state and spell your name for the record. You may begin.
Cyrus Hojati, Cyrus, Hojjaty. There's a lot of things I like about this bill. I think that pedestrian safety is very important, and I want to echo one of the previous callers that we have one of the highest rates of pedestrian deaths. But I don't think it's just that can help. I think there's a lot of other factors. I just wish that the bill could also address crosswalks that are paved other than asphalt, so people can see how to drive, because the paint on the streets, particularly in Las Vegas, can go away. I think raised crosswalks that can help, and there are better alternatives to stop signs. And I think this bill should also talk about roundabouts, particularly turbo roundabouts. I think you should look that up. They do this in Europe, and it really moves car traffic and pedestrian flow a lot more effectively. So there's a few things missing, but other than that, I really am delighted to talk about pedestrian safety. It's a very important issue. A lot of people cannot afford cars, and the roads that we design, particularly the major arterials, which is the largest concern out here, really need serious reform. Thank you.
Thank you. Any additional callers in neutral?
For any additional callers, for the neutral position on Assembly Bill 343, please press star 9 now to enter the queue. Chair Ratty, at this time, there are no additional callers wishing to provide neutral testimony.
Thank you. With that, we'll go ahead and close the public testimony on AB 343 and bring it back to the sponsor for any closing remarks.
Assemblywoman Claire Thomas, for the record, thank you so much. Committee on Human Health Services, I appreciate the time that you've given this bill. Thank you.
Thank you, Assemblywoman. Good luck with the rest of your afternoon. All right, with that, we're going to close the hearing on AB 343. That's our last significant item of business for today. In terms of planning ahead, on Thursday, May 13th, we will have a meeting that will have an extended work session. And then we will hear one bill, SB 424. If you're not going to be available at all during our traditional time, please let me know, because work session is our primary duty for Thursday. And with that, we'll go ahead and see if there's anybody who would like to make public comment. Anybody in the room who wants to make public comment today on any topic? All right, we'll go ahead and open it up on the phone line. Is there anybody who would like to make public comment today for Senate Health and Human Services?
Callers, if you'd like to provide public comment today, please press star 9 now to enter the queue. Will the caller with the last 3 digits of 490 please press star 6 to unmute yourself? Once again, caller with the last 3 digits of 490, please press star 6 to unmute yourself. Thank you, caller. Please state and spell your name for the record. You may begin.
I'm sorry, I just did it by mistake. I'm really sorry. I lost my thought. I apologize. I'll move on.
No worries. Thank you, caller. If there are any additional callers who would like to provide public comment, please press star 9 now to enter the queue. Chair Ratty, at this time, there are no additional callers wishing to make public comment.
Thank you, and thank you to those members of the public who have engaged with us. With that, we are adjourned. I'll see you all on Thursday. Thank you so much.